everyone, I'm Anastasia. I welcome you all to this new session of Fundamental of Nursing. So in today's session, we are going to be discussing about the urinary elimination. So here, what do you mean by urinary elimination? This is the process of removing the excess fluid or the metabolic waste from the body when the urine is excreted, right? So in this session, we will be discussing about how this urine is excreted from a person, as well as what are the various organs which are involved in this urinary elimination. So here, as we know that the organs which are involved for this urinary elimination include the kidney, the ureters, the bladder, and the urethra. However, these major components, along with some accessory structure such as the ring-shaped muscle known as the internal and the external sphincters, work together in order to produce urine collected and then excreted from the body. Since this urine elimination or the process of urination occurs when the urine is excreted from the body, here usually in normal condition, the normal amount of urine which will be excreted is 1500 to 3000 ml each day. So if a person is not able to excrete this required amount of urine per day, then this may serve as an indication that he may be suffering from some renal diseases which can also be life-threatening. So here, once the bladder is filled with this excess fluid or the metabolic waste, then only you will be having the urge for urination. However, this urge for urination becomes very apparent, especially when the bladder distends with approximately 150 to 300 ml of urine. So this distension with urine causes an increased fluid pressure, which will stimulate the stretch receptors in the abdominal wall and also create a desire for emptying the bladder. And as I've said that the urinary system consists of the kidney, the ureters, the bladder, and the urethra. So here it is very important that all these organs must be intact, it must be functional in order to be able to successfully remove the urinary waste, right? So here, what is the function of the kidney? The kidney is responsible for removing the waste from the blood to form the urine, and once this urine is formed, then the ureters will be responsible for transporting this urine from the kidney to the bladder. The bladder will hold the urine until the urge for urination develops, and once this happens, when a person goes and urinates, this urine will leave the body through the urethra. That is why it is said that all these organs must be intact and must be functional, because if one is not functional, then this whole process will be disturbed and this will lead to an impaired urinary elimination. And also here, an intact efferent as well as apparent nerve from the bladder to the spinal cord and brain must also be present, because it is only through this that it will send the receptors and we will be getting the urge for urination. So starting with the first, which is the kidney. Here, as we know that this kidney lies on either side of the vertebral column behind the peritoneum and against the deep muscles of the back. So normally the left kidney will be higher than the right because of the anatomical position of the liver. These kidneys are responsible for filtering the waste product of metabolism that collect in the blood. So how does this blood reaches the kidney? Here the blood reaches the kidney through the renal artery that branches from the abdominal aorta, and as we also know that approximately 20 to 25% of the cardiac output circulates each minute through the kidneys. So here the nephron, which is the functional unit of the kidney, will be responsible for the formation of urine during this process. So here the nephron, which is the functional unit of the kidney and which is composed of the glomerulus of the Bowman capsule, the proximal convoluted tube, the loop of Henle, the distal tubule, as well as the collecting duct, will be responsible for the formulation of the urine during this process. So here there will be a cluster of blood vessels that will be forming the capillary network of the glomerulus. So these glomerular capillaries will permit the filtration of the water, glucose, amino acids, urea, creatinine, and also the major electrolyte into the Bowman capsule. However, if there is presence of large protein and blood cells, then these does not normally filter through the glomerulus. So here, if there is presence of these large protein in the urine, which is also known as proteinuria, then this may be a sign that there is presence of glomerular injury. And here, as you also know, that the glomerulus filter approximately 125 ml filter per minute. However, not all of the glomerular filtrate will be excreted as urine. Here, 99% of it will be reabsorbed into the plasma and only the remaining 1% will be excreted as urine. Here, as we also know that the kidney plays a key role in the fluid and electrolyte balance, and although the output does depend on the intake, the normal adult output must be approximately between 1200 to 1500 ml per day. So if there is an output of less than 30 ml per hour, then this may serve as an indication that there may be presence of possible circulatory, blood volume, or even renal alterations. As the kidney is also responsible for producing substances which is vital to the RBC production, to the blood pressure, as well as the bone mineralization. They are also responsible for maintaining the normal RBC volume by producing erythropoietin. So once this erythropoietin is produced, then this will function with the bone marrow in order to stimulate the RBC production and maturation, and this will also help to prolong the life of the mature RBC. So this is the function of the kidney, right? Here, this kidney is not only responsible for the formation of urine, but here, this kidney, right, as I've said, is responsible for collecting all the waste from the blood to form the urine. And who will do this? The nephron is responsible for this, right? And also for this to happen, it is very important that the glomerulus, the Bowman capsule, the proximal convoluted tube, the loop of Henle, the distal tube, and the collecting duct must be in a good working condition. And also, since this is responsible for the amount of urine elimination as well as for producing several substances which is vital to the RBC, to the blood pressure, and also to the bone mineralization. So here, because of this, it will also produce the erythropoietin, right? And once this erythropoietin is produced, this will work together with the bone marrow in order to stimulate the RBC production, maturation, and also to prolong the life of these mature RBC. So this is the reason why it is very important that the kidney must be functional. And as you have also seen that in those patients who are suffering from chronic kidney diseases, they will not be able to excrete the normal amount of urine, as well as they will not be able to produce the sufficient amount of these hormones, which would thus lead them to become prone to anemia. To excrete the normal amount of urine as well as to produce the sufficient amount of these hormones, therefore they are prone to anemia. So here, usually these people who has some chronic kidney disease or whose kidney is not functioning properly, then these people tend to become more prone to develop anemia. So absence of these hormones or impaired production of these hormones not only lead one to suffer from anemia, but here these renal hormones can also affect the blood pressure regulation in several ways. In times of renal ischemia, which is the decreased blood supply, the renin will be released from the juxtaglomerular cells, and once this renin is released, it will function as an enzyme in order to convert the angiotensin, which is a substance synthesized in the liver, into angiotensin 1. This angiotensin 1 will then be converted into angiotensin 2 in the lungs. So this angiotensin 2 will cause vasoconstriction and also stimulate the aldosterone release from the adrenal cortex. So once this aldosterone is released from the adrenal cortex, this aldosterone will cause retention of water, which will increase the blood volume. And since the kidney also produces the prostaglandin E as well as the prostacyclin, which will help to maintain the renal blood flow during the vasodilation. So this is the mechanism which will then lead to an increase in the arterial blood pressure as well as the renal blood flow. The kidney can also affect the calcium and the phosphate regulation by producing a substance that converts vitamin D into its active form. This is the reason why patients with chronic alteration in the kidney function will not be able to make the sufficient amount of the active vitamin D. And because of this, they become prone to develop the renal bone disease resulting from the demineralization of the bone caused by an impaired calcium absorption. So this is about the kidney. This is how the kidney will filter, as well as this is how the kidney works for the elimination of the urine. Now moving on to the next, which is the ureters. These ureters are the tubular structure that enters the urinary bladder, and this process of draining the urine from the ureters to the bladder is usually sterile. So how does this draining, or how does the passage of urine from the kidney to the bladder occurs? Here the peristaltic wave causes the urine to enter into the bladder. These ureters enter obliquely through the posterior bladder wall. And because of this arrangement, it prevents the reflux of the urine from the bladder into the urethra during the act of micturition by the compression of the urethra at the uretrovesical junction, which is the juncture of the urethra with the bladder. So here, if there is any obstruction in the urethra, such as the presence of renal calculus, which we commonly call as the kidney stone, it will result in the strong peristaltic wave in order to make an attempt to remove the obstruction into the bladder, and because of this there will be pain, and this pain is often referred to as the renal colic. So this is how the ureters function in the urinary system. Now let us move on to the next, which is the bladder. Here the urinary bladder is a hollow distensible as well as a muscular organ that stores and excretes the urine. So once this bladder is emptied, it lies in the pelvic cavity behind the symphysis pubis. It rests against the anterior wall of the uterus and the vagina. So this bladder will only expand as it becomes filled with urine, and the pressure within it is usually low even when the bladder is partly filled, which is a factor that also protects against any type of infection. So here, once this bladder is full, it expands and also extends above the symphysis pubis. So here, as I have said, that an empty bladder usually lies in the pelvic cavity behind the symphysis pubis, right? However, once this bladder is full, then it will extend as well as it expands above the symphysis pubis. A gently distended bladder may also reach the level of the umbilicus. However, in cases of pregnancy, here in a pregnant woman, the developing fetus pushes against the bladder, thus reducing the capacity of bladder as well as causing a feeling of fullness. However, this effect mostly occurs only in the first and the third trimester. Here the trigone, which is a smooth triangular area on the inner surface of the bladder, is at the base of the bladder, and here an opening also exists on each of the three angles of the trigone. And out of this, two are for the ureters and one is for the urethra. So here, as I've said, that this bladder is a place whereby the urine will be filled, right? So here there will be one opening which will be the urethra, from which the urine can be excreted. So now let us move on to the last one, which is the urethra. So here, as the urine exits from the bladder to the urethra and also passes out of the body through the urethral meatus. So normally the turbulent flow of the urine through the urethra will be washing it and also make it free from any bacteria. However, the mucous membrane lining the urethra as well as the urethral gland secretes mucus into the urethral canal. So here what happens is that the thick layer of the smooth mucous membrane, and since the mucous membrane lining the urethral as well as the urethral gland will secrete mucus into the urethral canal, so these thick layers of smooth muscles will be surrounding the urethra. In addition, it also descends through the layer of a skeletal muscle called the pelvic floor muscle. So when these muscles are contracted, it also makes it possible to prevent the urine flow through the urethra. So this is how we are able to control when we have the urge for urination, right? Imagine if these muscles were not present, then we will not be having the urge for urination. We will not get an idea that, we should go and urinate. But because of these, it helps us to get that urination sensation, and it is also because of this that it helps to prevent the flow of urine. And also here we will be seeing that as one ages, this function of the pelvic floor muscles decreases, which is why in the older adults you will find that they may not be having that urge for urination. You may see that they may urinate anywhere and at any time, and when we question them, they say that they did not know that they were urinating, or they did not even have the urge for urination. Why? Because here, as I've said, that these pelvic floor muscles plays a major role in order to so this is the reason why these muscles plays a major role. So through these muscles, it is also possible to prevent the urinary flow from the urethra. In women, the urethra is approximately 4 to 6.5 centimeter long, and the external urethral sphincter, which is composed of the skeletal muscle, which is located about halfway down the urethra, permits the voluntary flow of urine. However, the internal sphincter's muscle is composed of the smooth muscles and therefore is not under voluntary control. So if there is presence of the short length of the urethra, then it predisposes the women and also the girls to infection. And because of this, it also becomes easy for the bacteria to enter into the urethra from the perineal area. However, in men, the urethra, which is both a urinary canal as well as a passageway for cells and secretions from the reproductive organs. This is about 20 centimeter long, and it also has 3 sections, which is the prostatic, the membranous, as well as the penile. So this is about the urethra. So this is about the urethra, and this is how it functions as a urinary organ. So now here we have come to the end of this topic, whereby in today's session we have discussed about the urinary elimination, where we have come to know about the various urinary organs, that is the kidney, the ureters, the bladder, as well as the urethra, and how each and every organ has its own individual role to play for the proper urinary elimination. So I hope you have got a clear understanding of this topic. I'll be meeting you in another session where we will be discussing about the acts of urination. So until then, have a good day. Thank you.